Hi, my name is Dr. Nilam Khurana, and I am talking to you a little bit about breastfeeding today. So, breastfeeding is a fun, tricky little thing. Babies don't know how to do it, and first-time moms don't know how to do it, and you do all these different things and classes to learn, and then you're stuck in the situation where who knows what's happened in your delivery, labor, whatever, you're exhausted, and now you have to figure out how to get this cute little baby to feed. So, a couple of tips that I like to give parents about the latch is having a good grip of the baby. Holding the baby is a little trick. You want to have a good grip of them without obviously putting their neck at risk. So usually I tell parents to put their body, the torso, on their forearm, their legs wrap around, and then you hold the baby up against you in whichever way you're going to. Then you've got a really good, they're solid up against you here, they've got their legs wrapped around here, and you're tipping them towards you, so you feel like you have a pretty good secure hold of them. And then the ball of your hand should actually be on their upper back. So when you're moving the baby, you're really moving them with your forearm and maybe the ball of your hand pushing in a little bit, but you're not actually moving their head. Their head will just cradle in your fingers, and then you'll be able to move the baby around whichever way you need to get them to feed. You have a free hand, so that you can squeeze your boob, because you have to squeeze your boob and shove them into you, and it doesn't feel very natural or beautiful at all. When they have a good latch, it really feels like you're worried that they're not going to be able to breathe. So you kind of put your finger there to give them some room under their nose, but you really don't need to, but you will, because you'll be worried they can't breathe initially. You'll get used to it afterwards, and they will, and you'll understand and feel the comfort and the flow of it. And then the other thing is, baby's mouth has to be wide open, and you line the baby up so that their nose is at your nipple. So babies' mouths don't open evenly like that. They open kind of like a bird. And so it's more on the bottom that opens. And so if you put their nose at your nipple, then that's basically going to help them get into the right spot, so that when they open their mouth is in the right position. And then you wait till they're wailing loud and clear with a good wide mouth, so that they can create that pumping action. They have to get in deep, because if they're not getting in deep, then they're not pumping, they're just at the edge sucking. And that's not gonna help the ducts that are in your breast empty. So, just like milking a cow, you have to get all the way up there and get it. So these guys have to really get far back and get a good grasp and then pump, rather than the sucking. So you don't really hear many sounds when a baby's latched well. If you're hearing sounds, then something's going on. Either clicking or like a sucking sound or any of those things means the latch isn't right. If the latch isn't right, you obviously want to get help, and the nurses in the hospital are usually awesome. And then on top of that, if they can't help you with it, they'll get the lactation specialist in. And usually you can get them to latch pretty well. If there's an issue with tongue tie, lip tie, or nipple confusion, those are the main things that we see babies will have issues with. Mostly it's tongue tie. And if it really is an issue, that's a pretty easy fix. It just gets clipped and then they latch really well. They need that tongue to reach out over the bottom and lift. It's a muscle, and that's the muscle that's creating a lot of the action. So if they're not able to use their tongue, they end up using their jaw and clamping and not getting a deep enough latch, and it hurts. It's not supposed to hurt. When they have a good latch, it's not supposed to hurt. And really the only sounds you're gonna be hearing is their breathing and their swallowing. So if something's not sitting right in all of that, then get it figured out, get it checked out, so you're not struggling unnecessarily along the way. Some babies will have the lip tie thing. It's a little tissue in between your upper gums and your upper lip, or your, like, just between your teeth. And all babies have that to a certain extent. It's whether or not they're not able to pull their lip up and sort of purse it out. If they're not able to do that, then they can't get that really good latch where their lips are going out and they are able to use their tongue to be able to do the squeezing of the breast and getting the milk out. So in addition to that, nipple confusion, sometimes if it's more like I got lazy on the bottle. If they get lazy on the bottle and they need to get back onto the breast, we have to trick them. So there's this thing called a supplemental nursing system, where they take a syringe or something and attach it to a very thin tube, and that tube then gets stuck over here, and you drip the milk into the baby's mouth as rapidly as you need to so that they realize that the milk actually comes from here rather than from a bottle. And usually within 24 to 48 hours of doing that, they're really good. You go fast initially and then you slow the flow as they start really trying so that they realize that they have to work at it and it's not going to just flow in their mouth as fast as possible. But initially, just to get them to attach and be interested in it, if they've been used to it coming fast, they have to have something coming in their mouth. So that's something you can get in the store from the lactation specialist. And it's not easy. And there's always the option of pumping and just giving it to them in the bottle. But it's nice to have them latch and bond, and also it helps to keep up your breast milk supply, and it's a nice thing if you can get them to latch on. So if you can, then that's a good option for you. That's really the big stuff I had about breastfeeding. So hopefully that answers most of your questions, and hopefully your baby's gonna latch well and you don't even have to deal with any of this. Congratulations on your baby, and thanks for listening. Okay, bye.